Assalamu alaikum to all. Or our brand new FM app, mobile app, or you can view us via Facebook or YouTube Live. Yes, indeed. All you have to do is just click on the live link of Facebook Live page or YouTube Live link of Inspire FM. As we all know, we cover different health-related topics, but sometimes we also cover a topic which is very, very common in our society. Pretty much, majority of the people are affected with that health conditions, and today is one of those same topics. So today we are talking about asthma care. Yes, we are talking about asthma care, and the best I can do about today is an international nursing day. So happy International Nursing Day to all our nurses. And definitely, when it comes to asthma, one of the common things which is a person who normally goes to. Whether you are going to a GP surgery or in hospital, you definitely have to see asthma nurse or a specialist nurse. And we are very, very lucky today that our guest for today is an asthma nurse. And she's not just an asthma nurse, she's also the GM, the general manager of Lieutenant Dunstable Respiratory Department. And she is none other than Farida Parkar. Assalamu alaikum, Farida.
Wa alaikum assalam, Fahad.
How are you today?
Alhamdulillah, I'm good, thank you. And I echo your thoughts in terms of happy Nurses Day to all those nurses out there.
Indeed, indeed. And I must say, it was I was really surprised today in the hospital that it was like everywhere. It was like a party kind of situation over there. And I loved it. I loved it today.
Yeah, perfect, actually. And like I said, I love Nurses Day. Like I said, I'm a passionate nurse. So good to see.
Indeed, indeed. As our topic goes, the way radio starts, I always ask my guests to introduce themselves. Although I've already said something about you, but tell us about yourself and thank you, Zaz. It's asthma, not asthma. So tell us about yourself.
Yes, I'm Farida Parkar. I've been a nurse a long, long time. And always at the Lieutenant Dunstable Hospital within the National Health Service. I'm local. I live in Luton. I wasn't born in Luton, born in Kenya. And all my family and friends are in Luton. I am a Cockney. So I belong to the Cockney community in Luton. But essentially, like I said, as far as, what I do, I've always been in L&D. I've done respiratory for many, many years now, actually. For asthma and many other respiratory conditions.
Indeed. And I must say you have won different awards as well. I think so. It's 2017 when you have won the community award for
something like that.
Yeah, exactly.
Something like that.
And yes, and it's my pleasure to work on my day job alongside with yourself.
No, alhamdulillah, thank you.
Let me involve our listeners as well. So listeners, if you have any questions regarding our topic tonight, which is asthma care, please give us a call on 01582 481822. I repeat, 01582 481822. You can share your thoughts questions or experience regarding asthma care on 079 0779 481822. I repeat, 0779 481822. You can send us text message, WhatsApp, and definitely share your thoughts, share your questions. If you have any questions, queries regarding our topic tonight, we have a very special person with us who can guide us and help us in many different ways. So, in regards of the topic today, as I said, it's about asthma care. So, Farida, first thing, what is asthma and what does it feel like to have one?
Yeah, so asthma is an airways condition. It's what we call a reversible airway condition. So it affects the lining of the lungs, it affects the airways. And the first thing I'll sort of say is whether if you have asthma, you should still be able to live a perfectly normal life.
Mm-hmm.
And the reason I say it's reversible is that those with asthma have to take certain medications to keep the airways nice and open.
Mm-hmm.
Those without asthma don't. And I say we have to be able to do anything and everything that a non-asthmatic does. So there are many athletes out there, top professionals who have asthma, but as long as it's managed well,
Mm-hmm.
then we should have no problems. But ultimately, what it is people with asthma tend to have sensitive airways, and there are many reasons for the sensitive airways. And there are many causes, and sometimes there are no causes. But the airways start to tighten. They get inflamed, they get swollen, and the airways start to tighten. And what happens in asthma is, for those who've been diagnosed with it, they can have many good days, but occasionally they might have a day where they might have come across a trigger, something might happen, and the airways become a little bit sensitive. The airways start to get inflamed, and they might notice a bit of a wheeze. Sometimes it's a bit of a wheeze, and there are medications that can take to open up those airways, and then they can go about their normal sort of day, really. But it is reversible, which means that medications keep the airways as open as possible.
Mm-hmm. Mm-hmm. So, how asthma is diagnosed and what test is required that one can have uh, that that can detect that one have asthma or not?
Okay, so the first thing we do, of course, when anybody presents to us, is we take a history. We look
Mm-hmm.
at the history. We think, right, okay, let's see what's going on. We look at things like, how long have these symptoms been going on for? Did you notice them when you were in childhood? Were you somebody who repeatedly had flare-ups in childhood where you were breathless, where you were wheezy? Some people may have had childhood asthma diagnosis and they're going through many years where actually they forgot they had an asthma diagnosis, and then suddenly something happens, whether it's a cold or flu, or they've come into contact with, I don't know, some pollens or something like that, and it sets off a response in their body to cause the airways to tighten. So what we do is we take a history. We
Mm-hmm.
take a history and we ask them about any sort of daytime wheezing, nighttime wheezing, any coughing, any breathlessness. Do they struggle with daily routines like walking, climbing the stairs? They get breathless? Do they persistently cough? Is it a dry cough? Is it a wet cough? And what does it feel like? What does it feel like? Do they have any allergies? Do they have any history of allergies that might be contributing to it? Is there a history of eczema? So we take a full history.
Mm-hmm.
And in terms of diagnosing, of course, we would probably think, right, okay, what do we do? There is something called a peak flow. So for those who have asthma, often our patients will keep a peak flow meter at home. And we will say to them, do your peak flow, blow into this tube, best of 3, and we'll see what it is. And normally with the peak flow, we determine what the best is or the predicted is based on age, sex, and height. And just as an example, if I don't know, I was 20 something years old and I was a 6-footer and a male, I might say, yeah, you need to be able to blow more than 600, 650. But actually, if you're seeing me and as part of that consultation, I get you to blow into that peak flow meter, and you're saying to me, I wake up every night coughing. I wake up in the middle of the night and I have to take my blue inhaler, and then take my blue inhaler in the daytime several times a day. And then you do your peak flow, and actually it suggests that your peak flow is, maybe 300 or so, or 50%, 60%, 80% of your best or predicted. Then I might say, actually, in those moments, your airways are tightening. Your
Mm-hmm.
airways are tightening, and we need to establish that. So that informs us about a potential diagnosis. We also do something called lung function test, or spirometry, some people know it as.
Mm-hmm.
And when we do spirometry, so for those who've had it done before, you'll know they blow into this tube, and the physiologist often, or the nurse, might say, keep on blowing. And we look to sort of see what the lung function. So it gives us a much fuller picture of what their lungs are doing, what the airways are doing. And following the initial lung function, we will give them an inhaler, like a blue inhaler, which opens up the airways. After about 15, 20 minutes, we will repeat the test and we look at something called reversibility. So actually, if there's quite significant reversibility following the medication, it tells us actually this is most likely to be asthma. But also we look at other tests, like exhale nitric oxide, which basically tells us there's an inflammatory process going on. So it is an inflammatory process. So those are the sort of things that tell us, is it asthma, is it not asthma? But also like regular peak flow, we'll give a peak flow diary and we'll say to an individual, look at your peak flows every morning, every evening, keep a diary, jot it down, plot it on a graph. And actually we correlate that and we sort of say, actually every night your peak flow drops. In the mornings is great. Or intermittently we notice a pattern which is very up and down. When you take a medication, it's quite evident that your peak flows improve. So those are the sort of tests that we look at that say, actually, it's most likely asthma.
Right. Okay. So, is there any treatment we can use, or they can carry on?
Yeah, absolutely. So if we've diagnosed you with asthma, and it really in asthma, it's what we call stepwise management. So depending on your symptoms, so if you first present to us and actually it's intermittent, it's occasionally you have a bit of wheezing or a bit of a cough, and while we're waiting to fully diagnose and you've not had flare-ups before, we might say, there's a blue inhaler. Let's see if that makes a difference. It's called Ventolin or salbutamol. We might say to you, take this occasionally and let's see. But ultimately, if you're starting to need that Ventolin on a regular basis, the next step was something called an inhaled corticosteroid. So some of you may know it as brown inhalers or brownish inhalers, Clenil, Becotide, something like that. So that's almost like the next step. And that's like a preventer. So the Ventolin or the blue inhaler is your reliever. So that's to be taken as and when you might think, you're a bit wheezy or a bit tight. But the brown inhaler, which is the steroid inhaler, and it's normally a low dose, we would say to you, you take it every day because it's a preventer. It's to prevent those moments where your airways tighten when you come across a trigger or something that causes that inflammatory process. So the brown inhaler, which is the steroid inhaler, should be and must be taken every single day, morning and night. And we would normally say to you whether it's 2 puffs or 1 puff. And depending on the type of inhaler it is, we might even give you something called a spacer. So if it's a puffer shape, like like an L shaped, we'll give you something to use it with to allow good deposition into your lungs. If it's a dry powder inhaler, you take it directly. But the important thing with any inhaler is that somebody must show you how to use it correctly. Because there are a lot of people who are on a number of inhalers. And unless it's taken correctly, and I always say this, that somebody, whether it's the pharmacist, the nurse, the doctor, they must show you how to use it correctly. Because if you use it correctly, it should go down into your airways, into your lungs with good deposition. It acts directly onto the airways. It keeps those airways open and prevents airway inflammation. Now, there are some people who have not been shown how to use inhalers. They will put it directly into their mouth, and actually they'll say, "Oh, it doesn't really work." And actually, that's through no fault of the person. It's because they've not been shown how. But following on from the brown inhaler, if people are still having symptoms, then we can step it up to different inhalers. So combination inhalers. People will see it as red inhalers, pink inhalers, all sorts, and we'll keep on going up the steps. And the aim of asthma management is to keep you on the step, the management step, which means you have good control on that. So we'll keep going up until you say, you know what, I have no daytime symptoms, no nighttime symptoms, and I hardly ever use my reliever inhaler or the blue inhaler, or I use it less than 2 or 3 times a week. So we will keep you on that step. But at any point, say, if we review you every month, 2 months, 3 months, and we say, you've got really good control, let's see if we can step you down, we might do that. But equally, if we think, actually, you've still got lots of symptoms, you're still wheezing, coughing, needing additional reliever inhalers daytime or nighttime, we will then say, we'll keep going up to the next step. Do we need to give you tablets in addition to those inhalers? So asthma management is a stepwise management, which is a step up and a step down, depending on how you are.
Now, you have used the word how often and very less often.
Yeah.
So how can one measure often as much? Because some people, although they're wheezing every night, but they're saying, oh, I don't often wheeze every night, but then there are times when they're wheezing every single night.
Yeah.
And there are people who are coughing throughout the day, but they're saying, no, I don't cough. So how one can judge that oftenness?
Yeah, absolutely. Now, as far as we're concerned, and I know everybody in primary care will tell you this, everybody in hospitals will tell you this, and in nurse who looks after you, I'm going to tell you this is an asthma action plan is key. So within an asthma action plan, we go through what your action plan should be. So we sort of say, actually, this is what good control looks like. This is what, not so good control looks like. This is what poor control is. And this is when you need to think, I need to go to accident and emergency department because, this is something that I really need to be sorted right now, really.
Mm-hmm.
Now, what we say within an asthma action plan is good control basically means you've got no daytime wheezing, no coughing, no breathlessness. You're not needing your reliever inhaler or your blue inhaler, or you're using it much less than 3 times a week. You can exercise and you can complete all your activities without any restriction, without breathlessness. So some people say, I'm all right when I'm sitting down, actually. But the minute I climb the stairs or the minute I go to the gym, I start coughing, cough, cough, cough. And I notice a wheeze. I have to stop and I have to take my inhaler. Now, the thing with asthma is if that's what's happening, you must discuss it with your doctor or with your nurse to sort of say, do you know what, I'm all right when I'm sitting, but the minute I try and exert, something happens and I need my inhaler. And it may be that your airways start to get irritated or extra sensitive when you're overexerting. Or you might say, I'm fine, but every time I walk across open fields or I come across somebody who's used a deodorant or a perfume, because everybody's different. That's the thing with asthma, is everybody's trigger is different. That's when we might sort of say, do you know what, in that case, we need to look to see what we need to put you on. So in answer to your question, everybody is different and everybody's symptoms are different. But if you're needing your reliever inhaler more than 2 or 3 times a week, it means your asthma is not well controlled and you need to see your GP or your nurse in the first instant.
Wow. Okay. That is, yeah, because sometimes it triggers with all the allergies as well, isn't it?
Absolutely.
And I will be asking you a bit of later on. But yeah, one of the things which I do wanted to ask you next is the asthma attack. Now, this is something which we hear quite often, that such and such has an asthma attack, and he just literally carry on. So, what is an asthma attack?
Okay. An asthma attack is when the airways become extra sensitive and extra inflamed. So if you imagine you got a nice open airway, you breathe in, you breathe out, not a problem. No coughing, no wheezing, run, skip, jump, whatever you want. But suddenly you think, oh, I've just done this and I'm a little bit wheezy. I take a couple of puffs of my blue inhaler and I'm absolutely fine again. Brilliant. That's what should happen. But actually, if you're not able to complete sentences, if you're wheezy, if you're coughing and you can barely sort of talk because your airways are so tight, that is when you need to seek urgent help. And the nature of the action plan, if you like, is we teach you how to manage your asthma. So understanding actually, how do I nip it in the bud before I have a full-blown asthma attack? And when you have a full-blown asthma attack, which means your airways are so tight that you can barely breathe, you can barely complete a sentence, you haven't even got the energy to cough, I will sort of say. And when somebody's near you, they can hear those noises and the relievers and the inhalers are not making a difference. That's when you need to seek help. And what I will sort of say is a person who's having a full-blown asthma attack with no relief from the inhalers needs to seek urgent help because, and I will say this not lightheartedly, asthma kills. If we don't look after our asthma or if we ignore the symptoms from one day to the next, it's not like a headache. A headache, you think, do you know what, I'll sleep it over or I'll take a couple of paracetamol, I'm sure I'll be all right tomorrow. If your asthma symptoms are escalating, your airways will continue to get tighter and tighter and tighter. And what you need at a particular point are steroid tablets. And unless you recognize that your peak flows are dropping to less than half of what it should be, you're not able to complete sentences, you can barely breathe or your airways are tight and you're making a wheeze or a persistent cough, unless you have steroid tablets called prednisolone, that will continue to tighten to the point where your oxygen levels will be depleted. This is when really you have to call an ambulance. And if you ignore your asthma symptoms and you continue to get tighter and tighter and tighter and you can barely speak, that's a dangerous situation. So absolutely seek help. We'd rather you seek help sooner and we say, do you know what, you're all right, than you wait until you've ended up in A&E where we have to do multiple things to try and get that airway open because it can be fatal. So I always say take asthma seriously. Don't think about asthma every day if you're well, but recognize the symptoms that make you think, do you know what, I need to do something about it and I need to take notice. Yeah,
indeed, and definitely asthma is not something we should take easy. It is something which we have to take care seriously. And on that note, I like to ask our listeners as well. So if you have any questions or queries, so listeners, if you have any questions or queries regarding our topic tonight, please give us a call on 01582 481822, or you can send us questions or WhatsApp on 07779 481822. I repeat, 07779 481822. I have a couple of questions in front of me. One of the questions says, are there early symptoms to identify asthma? Asthma.
Yeah, I mean, like I said, asthma can be very individualized. So, what I always say to everybody, regardless of what medical condition it is know your body.
Hmm.
Know your body, know what it feels like for you to be well. And if you have asthma, know what your asthma feels like. So, if you think, I'm normally well, I breathe efficiently with no problems, that's my well state. I take my inhalers regularly as I've been prescribed morning and night, that's brilliant. But what happens is, if you suddenly think, I've got this tickly cough, and I know every time I get this cough, it often end up in my chest, and then I start to get wheezy. Notice those symptoms sooner. And what I would say at that point is keep an eye on your peak flow.
Hmm.
Keep an eye on your peak flow and monitor your symptoms, and keep a diary.
Hmm.
Saying, keep a diary and say, actually, today, this is my peak flow, and this is how I feel, and this is what my cough looks like. And actually, I may be wheezy, or actually, I woke up once last night with a wheeze. I need to keep an eye on that. And that's really, really important, because if the next day your symptoms are a little bit further down, that you've woken up twice that night, or even in the daytime, you're coughing persistently and it's a fairly dry cough. And some people bring up mucus, but you start to notice that whistling sound, that wheezing sound.
Hmm.
Actually, that suggests your airways are telling you that it's tightening. Now, some people say, do you know what? I never get wheezy.
Hmm.
I always know that my asthma is starting to play up because I get this particular cough. If that's what it feels like to you, that's when you need to start to take notice. But the majority of people start to notice not just the cough, but it's that noise, that whistling noise, the wheeze.
Hmm.
Yeah.
Indeed. One of the other questions, which is right in front of me, is children asthma? Is children asthma flares up in adulthood as well?
Does childhood asthma flare up in adulthood? Yeah. Now, what we do say is asthma, as I said at the beginning, it's a reversible airways condition. So if we control it well, you should almost forget you have asthma as long as you take the right medication on a regular basis.
Hmm.
Now, what happens in childhood asthma is there may be many reasons. Some people have recurrent things like bronchitis or whatever, and it causes the airways to become a little extra sensitive. And then as a child grows up, asthma sort of becomes stabilized in itself, because there are so many, so there are hormonal changes which make it better or can make it. So hormones, as an example, can sometimes make the asthma better. Some people say, do you know what, brilliant. When I'm pregnant, my asthma is brilliant. But it can equally have an opposite effect. So as we grow up, some people find that actually they've forgotten they had asthma, completely forgotten. And then suddenly, they become teenagers or in their 20s, or certain stress environments. So during exams, new jobs, anything like that, family crisis, suddenly they have a flare up and they suddenly say, oh, they'll come into A&E and they'll say, do you know what? I used to have asthma. It went away, but this is the first time in 10 years. But actually, asthma doesn't go away. It becomes stabilized. It becomes settled. But once you've been diagnosed with asthma, and if you've had a proper diagnosis of asthma, it means at the back of your mind, you should be aware of what your triggers are.
Hmm.
And if those triggers are stress or certain environments or certain allergies, always bear that in mind, because it doesn't go away. It might be nice and stable where you may not need any particular medication for a period, but bear that in mind.
Indeed, indeed. And well, the screen is filling up with all the questions right in front of me. Right, there's another question came up, says, when is it alarming to go to doctor?
When it's alarming, what I'd say is, so good control, as I said earlier, is doing absolutely anything and everything you want to do without any symptoms, daytime symptoms, nighttime symptoms. Reliever inhaler less than a couple of times a week. But if you start to use your blue inhaler more often than usual, if you find you're not able to sleep and you're sort of short of breath in the middle of the night or early hours of the morning, and often people will say certainly between about 2 o'clock in the morning to 6, 7, 8 o'clock in the morning, I find that's when I'm at one worse. I get
Mhm.
up coughing and wheezing and I'm more short of breath. Those are and you're coughing,
Mhm.
you know.
Sorry, I have to stop you because we are about to go for a break. I
No.
completely forgot that we are reaching the critical time of having a break. So when we come back from the break, I will ask Farida to come back on this topic and complete her answer in terms of the when do we need to go to doctor. So stay tuned. We will be right back after these very short messages. Stay tuned.
Assalamu alaikum. In Luton and its surrounding areas, it is now time for Salat al-Asr.
लुटन और इसके मज़ाफ़ात में नमाज असर का वक्त हुआ चाहता है.
This azan is sponsored by Hannah Solicitors, specializing in conveyancing, family law, immigration, and personal injury. Call us on 01582 329 069.
Allahu Akbar, Allahu Akbar, Allahu Akbar. Ashhadu an la أشهد أن لا إله إلا الله أشهد أن محمدا رسول الله أشهد أن محمدا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله
اللهم رب هذه الدعوة التامة والصلاة القائمة آت محمدا الوسيلة والفضيلة والدرجة الرفيعة وابعثه مقاما محمودا الذي وعدته إنك لا تخلف الميعاد.
This adhan is sponsored by MI Law, specializing in criminal law. You can find us at 21B George Street, Luton, Bedfordshire, or contact us at 01582 733 330.
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. I welcome you back to the Health and Fitness Show. I'm Fahad Matan, your host for today's evening, and we are talking about asthma care. Or shall I say asthma care? With our guest, Farida Parkar. She's the specialist nurse and the general manager of Respiratory Department in Luton and Hospital. This program is broadcasting live today on 12th of May 2022, and the time just past 6:30. From the studios of Inspire FM, we are presenting from the studios of Inspire FM for our lovely people in Luton and all the surrounding areas of Luton, like Dunstable, Harpeth, and Bedford. And our airways, our positive airways, reaching all our listeners who are listening us either via Inspire FM radio, mobile app, website, or viewing us via Facebook Live and YouTube live channels. So welcome back from the break. Before we went on break, I have asked, one of our listeners have asked a question, and I've relayed that question to our lovely guest, Farida Parkar. So first of all, Assalamu alaikum, Farida. Welcome back. So, Farida, before we went on break, I've asked you a question regarding when is it alarming to go to the doctor, and you were explaining us so nicely, and I completely have to stop you halfway through. So if you don't mind, carry on.
Yeah, no problem, Fahad. So signs of your asthma getting worse. So in the first instance, if you're starting to use your reliever inhaler, your blue inhaler a little bit more often than usual, you're not able to sleep because you're breathless, you're wheezy, waking up in the middle of the night. Now, remember I said earlier, if your peak flows, you know what your predicted your best is. And at this point, when you're feeling more symptomatic, your peak flows are about 70 to 80% of your predicted. Then what you do is you take your reliever inhaler a little bit more frequently, every 4 to 6 hours. Keep an eye on your symptoms. And for those of you who might be on a steroid inhaler, like a brown inhaler or a pink inhaler, you can double up the dose morning and night or take an additional dose in between. And you might find that that alone for a few days will settle your symptoms and you'll go back to good control. However, if you're finding that you're needing your blue inhaler every 3 hours or more often, you're more wheezy, more short of breath, more coughing, and you're starting to have difficulty with your day-to-day activities. So you're trying to do your housework and you're more breathless and wheezy, or you're just walking along in the park and you're thinking, oh, I'm really puffed, I'm starting to cough and wheeze. And if you went home and you did your peak flow, it was half of what it should be, about 50 to 60% of that. That suggests that taking your inhalers alone at this stage would not be enough. And for those of you who keep prednisolone or steroid tablets at home, we would then suggest that if your peak flows of half of what it should be, you start taking those steroids, about 8 tablets every morning for about 5 to 7 days. If you don't keep steroid tablets, our advice normally is you ring your GP straight away and you say to the GP, or the nurse, you say, I'm an asthmatic, I have occasional flare-ups. At the moment, my peak flow is this, my best peak flow is this, and I'm having difficulty completing sentences and I'm just really struggling with my breathing. Some surgeries will leave a prescription and they'll say, start the steroids straight away. Others may say, look, come and see us. Now, that may be enough to relieve some of the airway inflammation and get you back to good control. However, what I would say an emergency is if you're having difficulty in completing your sentences, severe difficulty in getting your breath, if you like, the reliever inhalers are not getting down, you're getting no help, relief whatsoever. You might not even be able to do your peak flow at this point, but if you did, it would be less than 40% or less than 30%. You barely be able to manage sort of 100 or 120, 150, something like that. That's when you would call 999, call the emergency services, or get to A&E as soon as possible. And while you're waiting for help to arrive, you would take a puff of your reliever inhaler every minute for 5 minutes until your help arrives. And if you've got a spacer, you keep puffing away there, because what you're trying to do is get that reliever in to keep your airways as open as possible until you get help, where they might then, the paramedics or the ambulance or in A&E, they might give you a nebulizer, which basically is Ventolin, same medication that's in your blue inhaler, but a much more potent dose, which is nebulized through this machine and this mask, which gives you like an inhalation, like a steam inhalation, which then goes directly into your lungs and into your airways and opens it up very quickly. And you might need that for a few days. They might keep you in hospital, or they might say, we'll give you this nebulizer in A&E or at the surgery, once or twice, and then give you a course of steroid tablets.
Mhm.
So those are the symptoms that you need to look out for. But at that point, I would sort of say, get help immediately.
Indeed, indeed. And by the sound of the whole experience you just explained, I must say that's a terrifying experience for a person who's going through that phase at that time, because you can't breathe properly. And when I know when a person can't breathe properly, they can't think properly.
Absolutely. It's a very, very frightening experience, which is why we say, think about your asthma a few steps in advance and seek help sooner rather than later, so that actually it may just be that at a particular stage when it's just beginning to get worse, additional doses of your steroid inhaler may be enough. But also recognizing that actually if that's not working, starting the steroids as your nurse would have discussed with you at that particular point when your peak flow is only half of what it should be, but also recognizing actually this is an emergency. I need to get to A&E straight away, because asthma is a reversible airways condition. And if we give you the right medication at that right time, absolutely you will recover completely and you will go back to your normal day-to-day life. However, if you ignore the symptoms repeatedly, then that's when you're in trouble. And I always say, if you're in doubt, if you can't get through to anybody in any surgery or whatever, I'm always happy for people to contact the hospital, to the respiratory nurses, get some advice, because we're around, and absolutely that's what it's all about. It's about keeping your symptoms under good control.
Indeed, indeed. And one of the things I do like to ask is, as we are approaching towards the summer weather, we are entering summer weather, so we will go outside, and definitely there are more foods available. We have garden parties and so forth, and sometimes we are going in sea area, gardens, different places. So people sometimes do not know that they do know that they have asthma, but then they might not know that they might have been allergic to X, Y, and Z food wise or pollen wise or something like that. So can those things also trigger asthma attack?
Of course. Like I said, the triggers are very individualized. So everybody is different. So for one individual, it may be that every time they smell fried foods, it sets off a response in their body and in the airways to cause the airways to start to tighten. For others, they might just sort of say, you know what, every time I go, I'll give you an example. Every time I go to the Arndale and I walk past the Lush shop where you've got all those fragrances, they notice that by the time they get home, their airways are quite tight. Again, things like certain allergies. So for some people, asthma can, be worsened seasonally. So whenever there's changing weather, they notice the asthma gets worse. So for some, it might be from spring to summer. For others, it might be from autumn to winter. So know your body and know when your asthma symptoms are likely to get worse. And it's at that point, you almost like take precautions. So if you're known to be allergic to particular things, so one of the parts that we do in history taking is say, are you allergic to X, Y, and Z? We do allergy tests as well, to determine what it is. But if you know you have an allergic response every time you've bumped into somebody's cat or somebody's dog, or you've eaten, I don't know, certain foods, if you know that that makes your airways tight, I would also say absolutely try and avoid it. But of course, there are certain environments, certain situations we can't fully avoid. And it's about things like taking precautions, making sure you take your inhalers appropriately and efficiently before you expose yourself to that environment. And for some people who have allergies and they're allergy-prone asthma, if you like, they might be on antihistamines. So, those hay fever tablets, as I call them, so making sure you're taking those to prevent you putting yourself in a very difficult situation.
Indeed, indeed. And on this note, let me introduce our listeners as well. So listeners, if you have any questions or queries regarding our topic tonight, please get in touch with us by calling us on 01582 481822, or you can send your questions by text messages on WhatsApp or on Facebook app as well on 0777948182, or you can send messages to our Facebook live feed as well. So I have quite a few messages right in front of me, Farida. Okay. So let me go through one by one. Hang on a second. Where is it? Yeah. One of the questions says, can anyone on regular inhalers does skip some of their dosage?
Can they skip some of their dosages? Now, if we've suggested, if your doctor or nurse has said you need to take this steroid inhaler regularly, morning and night. Now, at the moment, we have some steroid inhalers or combination inhalers which must be taken morning and night. Some of the newer ones, they work over 24-hour periods, so they might only need to be taken once a day. Whatever the instruction from your nurse or doctor is, you must stick to it. You should never intentionally skip a dose. If you forget to take a dose, take it at the earliest opportunity. So the message I give is compliance. You must be compliant with your medication and follow the instructions given by your doctor and nurse. But ultimately, if your inhaler says you take it twice a day, you must take it twice a day. If your inhaler says you must take it once a day, you must take it once a day, whatever it is. And try not to deviate from that, because if you skip repeated doses, you're exposing yourself and your airways to becoming more inflamed and irritated.
Mhm.
And then you will have an asthma flare-up and an asthma attack.
Right. Wow. And that becomes very, very serious normally. Right. One of the other questions says, is asthma inheritable? Inheritable.
Is it inheritable? Well, there can be a family association, if you like. So one of the questions we ask when we ask you questions when we're determining whether you have asthma or not is there a family history of asthma?
Mhm.
Now, for some people, you'll notice that allergy is familial.
Mhm.
Within a family, people are often allergic to similar things. They might have, within the family, you might have eczema. And one of the reasons we ask whether there's any family history of asthma is that it doesn't mean that just because your mom or dad had asthma, you will have asthma, but it might mean that actually we need to be mindful of that and aware of that, because you might be more sort of predisposed to getting asthma.
Mhm.
It's not a guarantee, because we have many families where only one individual has asthma, but it's just something that we're aware of, because it might just suggest that it's a likely diagnosis if you present with those symptoms.
Mhm. Couple of the Facebook questions. Is COVID symptoms appeared badly on asthma patients?
Did COVID symptoms appear badly? I mean, absolutely. I mean, COVID, very, very challenging time. And I don't know that we're out of it completely. But, our asthma patients and our other chronic lung disease patients, we class them as one of our clinically vulnerable patients. So for those patients, we always said, absolutely, they must have their vaccinations. And if there's a message I can give out today, is to make sure that all our listeners have been vaccinated for COVID-19, because it's the single most important thing you can do to prevent. It might not prevent you getting COVID, but it certainly minimize the symptoms that you get should you become COVID positive.
Mhm.
And if you have asthma and you can become COVID positive, absolutely, it can have an impact on your chest. It can make you more breathless. And there are many changes that can take place with COVID within your lungs. And what I say is, don't put yourself into that situation. So if you're somebody who has not been vaccinated, absolutely, you must get vaccinated, because people with lung diseases are vulnerable when it comes to COVID.
Mhm. And one of the other questions says, what are the emergency kit or medication for asthma patients to carry every time during the traveling, especially by air?
Yeah, always carry your inhalers with you. Always, always, always. So when you're traveling by air, make sure you've got your inhalers in your hand luggage or your handbag, even in the airline, because you don't know when you'll need it. And of course, when we're flying with the altitude, some people, not everybody, some people might find that there is a depletion of oxygen, if you like, the higher the altitude. And for some people, that alone might be a trigger. So you must carry your reliever inhaler, you must carry your preventer inhalers in your handbag. And also important that even if you're not needing it in flight, how often have we lost luggage or luggage has been late? So at least if you've got it in your bags on you, it's there available.
Mhm.
And actually, there's nothing worse than having that sudden, thinking, oh my God, my inhalers are in my suitcase, which I haven't got with me. And what am I going to do? And that stress alone can worsen your symptoms.
Mhm. It's good to just said about the stress alone. So what's the basic difference between an asthma attack and a panic attack? Because I remember one of my friends, we were working together, and she had a very big panic attack, but then she was also worried that it might be asthma attack and everything's tightening up.
Yeah, yeah.
So it was really hard for her to identify. How one can identify that?
Yeah, and sometimes that can be difficult for her, actually, because I mean, the first thing I'll sort of say, panic is one of those words where there can be a stigma associated with, and really, if you've ever suffered from one of the panic attacks, it's very much an overwhelming sensation that can cause your body to seize up, that can cause you to feel like your airways and everything is tightening up,
Mhm.
and the first thing I also say, if you feel that somebody, if it's somebody who is known to have asthma and you know they've got asthma, they will sometimes carry a card with them or some notification they've got asthma. If they're exhibiting those symptoms where it feels like that they're wheezing and they're tight, which is setting off this panicky feeling, then absolutely take their inhaler out of the bag, pop it into the space if they've got one, put it in their mouth, spray it, and just ask them to calmly try and inhale that to try and open up their airways. Now, people who don't have asthma can have panic attacks. And actually, one of the things that I also suggest is just to calm them down, talk them through some deep breathing and relaxation, and just to work through things with them and to sort of say, it's almost like in a nice sort of gentle manner to try and calm things down. Now, you will find that just that sort of relaxation technique alone should settle things down. But what I will emphasize is if they're known to have asthma and they're wheezy and that panic is causing a cough and breathlessness, get their inhaler out of their bag, pop it, spray it in there, and just calm them down at the same time.
Yeah, because when you are in that stage, it's really hard.
Frightening.
It's really
very,
really
very frightening. But like I said, we can always just, the first most important thing is to try and be gentle and calm and do deep breathing and relaxation.
So, is there any health condition that can mimic like asthma?
Yeah, as you said, one of them, sometimes people can have repeated sort of anxiety and overwhelming sensations that can mimic it. But, there are, asthma is one of those conditions where it can be either overly diagnosed or underdiagnosed. It's about taking the full history. And as I said earlier, daytime, nighttime symptoms, what is it that contributes to that really? But sometimes certain, how do I put it really? Disordered breathing. Yeah, disordered breathing, hyperventilation, those sorts of things can be almost be described as asthma when actually they're not. So one of the things that we do is in determining whether it's asthma or not, we look to see how the person is talking to us, what the breathing tests are showing us, what the peak flows are showing us. But for some people, when they're talking, they have what we call like a disordered breathing, or hyperventilating, and that can almost like be misinterpreted as asthma, and it isn't always. But there are many other conditions, and sometimes the breathlessness itself, breathlessness doesn't necessarily mean it's asthma. There are certain heart conditions that can cause breathlessness. You see, so it's just being mindful, doing the right tests, and your doctor and your nurse will certainly make sure that they do the right investigations to tell you what it is.
And is there any age where you can get an asthma, or it can be
any age from birth to death? I would sort of say we get people with late onset asthma. So we get people in their 50s, 60s, 70s even now that can present with late onset asthma. People can be born with asthma. So it's at any age.
And one of the very there was a myth that kids who normally have asthma, when they've grown up, they're normally grown out of asthma as well. Is that true?
I mean, we have many adults who, as children, had repeated admissions or repeated asthma exacerbations, and like I sort of said earlier, it's our bodies change. Our bodies change, and it may be that within our bodies, whatever is hormonal or otherwise, our growth really just allows us to settle. But equally, there are certain factors in childhood that might contribute to those having asthma attacks. In childhood, people have croup, they have repeated infections, all those things. But what I sort of says, if you've had childhood asthma diagnosed, it's about being mindful that yes, you were diagnosed with asthma, you've kept well in adulthood. You might, I wouldn't say grow out of it, but you might just be so well controlled, not needing any medication, but certain triggers will just set it off again. Yeah.
Wow. Okay. In terms of when we talk about the one of the very taboo topic is smokers and smokers cough, and they sometimes been classed as it might be asthma or not, or asthma cough. So a person who's a smoker, can they develop asthma, or are they very prone to get asthma?
Yep. No, smoking, absolutely. If you think about, we inhale cigarette smoke directly into our lungs. Dreadful. Now, one of the things I'll say is you may have had asthma anyway, and if you're an asthmatic and you smoke, you're putting yourself at risk for something called chronic lung disease, COPD, emphysema. Now, asthma is reversible. Yeah. COPD and emphysema is irreversible or partially reversible. In asthma, you should be able to do anything and everything a non-asthmatic does, provided you take the right medication. When you've got emphysema or COPD, which is chronic obstructive pulmonary disease, breathlessness becomes the normal. So you might find that you walk 100 yards and you get breathless, 50 yards and you get breathless, climbing the stairs. That becomes your normal. And what I'll say to anybody, whether they've got asthma or not, if you want to live your life breathless and struggling with lots of mucus and needing lots of antibiotics medication, then smoking is the answer. If you want to have a better quality of life, whether you have asthma or not, then you must quit smoking.
Indeed, indeed. And on that note, I must say, wow, the time has passed so damn quickly. It's 5 minutes to the show before it ends, and I still have a few more questions. So, in terms of the medication, now some people do say that they have. What are the allergies or the side effects of the asthma medications? Are there any allergies as well?
Yeah. Well, absolutely. I mean, people can be allergic to anything, you know. So some people might be allergic to particular ingredients in an inhaler. However, it's the side effects. So steroid inhalers, because of the nature and how we take them, one of the side effects of steroid inhalers is thrush, or like a fungal infection in the mouth or the back of the throat. And for that reason, we say if you're on a steroid inhaler, you must always rinse your mouth, gargle, and spit it out. And one of the good habits in terms of remembering that, because if you imagine if you're on an inhaler which you've been told to take twice a day, first thing in the morning, last thing at night, I'll always say good practice means take your inhaler in the morning before you brush your teeth, then gargle and spit it out. Take your inhaler last thing at night, brush your teeth, gargle and spit it out, because the deposit of some of the steroid medication can cause a thrush. And if anybody's had thrush in their mouth at the back of their throat, it's a very nasty sensation and very uncomfortable, and it can cause some difficulty in swallowing as well. And for some people also, they can have some voice changing because of the steroid dosage sitting at the back of their throat, really. So rinsing your mouth and gargling minimizes that risk.
Oh, wow.
And if you've got a spacer with an L-shaped inhaler, then again, that minimizes the risk. So always use it.
And I must say, I was hearing spacer quite often. So is a spacer better to use than the normal puff right in the mouth?
So we have what we call meter dose inhaler. So the L-shaped inhaler is the one that's suitable to be used with a spacer. And the idea that if you use the inhaler straight in your mouth, the deposition, so the amount of medicines that's deposited into your lungs can be maybe 5, 10%, 15%, depending on how good you are at it. But if you use it in a spacer, immediately you're probably, I mean, there's no guarantee, it's no science there, but 40 to 60% is depositing, because the spacer is a holding chamber. So you push the drug into the holding chamber, which is the spacer, and then you inhale it through the spacer. So it's deposited and the gravity allows it to go deeper into your airways. So one, it minimizes the risk of your side effects. And two, is deposited into your lungs so that it works much more efficiently.
Wow. Thank you so much for sharing those absolutely brilliant. I've lost the words. The information you have given us, that there are so many things which I do not know anything about it. So before we end up the show, I normally ask for a quick catch up, but we just have 2 minutes. So a quick catch up and a positive message, if you don't mind, please.
Yeah, no, definitely. So what I'll say to all your listeners, Fahad, is if you've been diagnosed with asthma, don't fret, don't be worried about it, because asthma is absolutely a reversible condition. But listen to your doctor, listen to your nurses. If they've given you inhalers to take them as you've been instructed regularly, and you'll be able to live a perfectly normal life. Absolutely no issues whatsoever. If I can say to you, people like David Beckham, you know, I understand he's an asthmatic. He's one of the most athletic people around. He lives a perfectly normal life. So when you've been diagnosed with asthma, absolutely think of yourself as David Beckham, and you'll be all right.
Wow, definitely. I'm surprised that a person can be asthma and being athletic as well.
Completely athletic, absolutely. There are many footballers, many sports, you know, highly efficient sports people who have asthma, and because they manage it well, you know, they, you wouldn't even know it. So absolutely, I would say to your listeners, you know, but equally, listen to the advice, follow your action plan, you know, and and just, you know, it'll make your quality of life so much better.
Perfect. Thank you so much, Farida, for sharing such valuable knowledge with us and giving us the guidance of asthma care. And I must say, it is an absolute pleasure to have you very first time on my show, but definitely we will have you again and again.
Oh, thank you for inviting me, Fahad.
and to our listeners as well. So if you missed any part of the show, please don't worry. You can always catch up on our Facebook live feed and YouTube live feed and for any part of the show. And definitely do remember us in your duas. Until next week, I will be back again. So thank you so much, Farida.
Pleasure.
Coming.
Thank you for inviting me. Thank you for listening.
And thank you so much for listeners as well for listening us. Inshallah, we will be back again next week with another topic.